Maryland, of the state of Maryland, because Senator Cardin has a long history of being a champion for health equity. The senator's legislation not only established the former National Center on Minority Health and Health Disparities as an institute at NIH, but he also ensured that there were offices of minority health and health equity at every federal health agency in the United States government, for which we are very appreciative, because this is what it takes to focus the work on the issues at hand. So please join me in welcoming our newly re-elected senator.
Thank you very much. Michael, thank you very much for this report. It couldn't be more timely. Elijah Cummings, my friend, my colleague, thank you for your extraordinary leadership in this country on these issues. This report is so timely because from here, I'm going to Washington. Congress is back in session. And when you look at this report, it speaks to what the Congress needs to get done right now, the decisions we're making. And I'm going to come back to that. But I tell you, where you live should not determine your opportunity.
That's right.
Where you live should not determine whether you can live a healthy lifestyle or get the health care you need. But it does. But it does. To me, it's shocking that there's a 30-year difference in life expectancy in our community based upon where you live. That is not acceptable. We saw a face of this in 2007 with a 12-year-old named DeMonte Driver. We saw where a 12-year-old could not get a tooth treated and lost his life. In the wealthiest state, in the wealthiest nation in the world. It happened. If DeMonte Driver lived in a different zip code, he would be alive today. We cannot let that happen under our watch. And yes, we can celebrate that we have made progress. Thank you, Elijah Cummings, for your extraordinary leadership in the House to get it included in the CHIP program, where every child in America now has access to dental care. We got that done. It's now the law of the land. We have made progress. We did pass the Affordable Care Act, Obamacare, and guess what? The people of this nation re-elected Barack Obama. We're going to move forward on the health care. We're not going back. I want to thank you for your leadership. Yes, we created the National Institute for Minority Health and Health Disparities, and we have a great leader in Dr. Ruffins who is leading in that effort. Thank you for making the funds available to do this study. Thank you. And to Berna Jones and to all of our state, to Shirley Nathan Pulliam, and to all the people here who are in the state level, thank you for your leadership. As was pointed out in the Sun papers this morning, because you moved forward with the Affordable Care Act, Maryland's in better shape than just about any state in the nation to help our people. So thank you for your leadership in this issue. Here's where I come back to why this is so timely. Elijah and I are going to Washington today. Congress is meeting. And we have this fiscal cliff. And it's a problem. There's no question we have to deal with the fact that we have huge deficits. Now, Elijah and I would like to tell you how we got here and how we fought those policies under the previous administration, under George W. Bush, but we are where we are. And we have to work on the fiscal problems of this country. And we have to deal with them. But when you look at this report, it tells us why we need to do it in a balanced way.
That's right.
Why we need to make sure we make the right decisions for America's future. We need to invest in affordable, decent housing in this country. This report tells us why. We got to invest in our environment. This report tells us why. We got to invest in our children. This report tells us why. We got to invest in education. This report tells us if we don't, that the values we hold so dear in this country, that everyone's entitled to the opportunities of America, will not be realized. That's why we have to get this right. That's why we talk about balance. Everybody playing according to the same rules, so that everyone can have the opportunity of America. And that's what we're going to be fighting for in this discussion on this fiscal cliff. To make sure that we listen to this report. It is so timely. I'm going to be talking to my colleagues today about this report funded by the National Institute for Minority Health and Health Disparities, and how important it is as a blueprint of what we can do. I agree with Elijah. When I look at the people in this room, I'm encouraged. I'm encouraged. You all understand that we can make a difference. You've done that as in your individual roles, but collectively we can bring about the change that we need. And we need to change what we see here. It's not just in Baltimore, it's all over the country. We've got to change what we see, because America is the greatest country in the world, but we need to make sure that everyone has the opportunity in this country, and your opportunity should never depend on the zip code that you live in. That's our mission to change. I'm optimistic that we can make progress, and I'm honored to represent you in the Senate. Thank you.